Today's date is June 8th, 2018. This is Sam Wall. He's a medical doctor from Chapel Hill, North Carolina, who came 3,000 miles to our ozone workshop. And we treat doctors during this. And you just told me you wanted me to shoot up your neck.
Right.
Actually, right here, it's gallbladder 20 area.
Right.
But I said, well, let's find out why you have had a headache for what, 15 years?
5 years.
5 years,
Every day.
nonstop, every day,
Every day.
24/7. It's
24/7.
just there, right?
Always.
So I did a dental history first before I did anything else. And describe the headache for us.
It's predominantly bifrontal. It's a pressure squeezing sensation. Occasionally there can be kind of a migrainous feature to it, but
Right here,
yeah, it goes
correct?
all the way across here.
Okay. So pressure, there could be a pressure squeezing sensation.
Right, all the
Okay.
time, nonstop.
Nonstop. Interfere with your work?
Oh yeah,
I'm sorry to hear that.
yeah.
So I did a dental history, and we checked, you had a root canal that was pulled from number 9. You had wisdom teeth pulled, and you had a couple down here that were pulled.
Right,
And of all the empty sockets, one of them checked positive.
right,
Number 17, which is a wisdom tooth.
correct,
And it's an empty socket.
correct.
I just shot it up with Procaine. So tell me, at this point, it's been about 2.5, 3 minutes since I've done it. Any further, where are you at now?
Definitely at least 50% reduction in the headache for sure, and maybe getting better.
Maybe getting better.
Yeah, I mean, I have it all the time, so I know. I mean, it's not like I have to wait to get a headache.
Okay, would you say this could be placebo?
I don't think so.
Did I suggest anything to you?
No,
I didn't suggest, didn't say a word.
no.
Tell me what's happening with the discomfort that was going down your arms.
Boy, I get fluctuating what feels like neuropathic pain, starting from my elbows down into my hands along the medial aspect.
Right, and has that changed?
I'm not feeling it right now at the moment. to be
Did you
honest
have
with
it earlier?
I did. I had it today
Okay,
Kinda comes
and
and
it's
goes.
gone at the moment,
at the
correct?
moment. Yeah.
All right, I want you all to come with me, please. So I took Sam and the doctor group into my exam room where I have the dental chart, and we were just dealing with tooth number 17. And that deals with the small intestine, it also deals with the heart, but it also deals with, what's that say right there?
Shoulder, elbow, ulnar hand, plantar, foot, toes, sacroiliac joint.
Does any of that sound familiar to you?
Yes. Especially sacroiliac. Yeah.
And you've had sacroiliac dysfunction too?
I have. Yeah.
All right, how does it feel right now?
Pretty good, I gotta say. Pretty darn good. It's amazing. I wouldn't. I mean, I've seen all your videos and I see this all the time.
I'm videoing all of you.
Okay.
All right, with permission, correct?
Yeah.
This is going on YouTube.
Yeah.
Permission, Sam?
But yes, sir.
Very good.
Yes.
Okay.
Thank you.
So what do you, you're very, listen, it's my honor.
Yeah.
What do you think I would tell a patient to do at this point?
Go to my holistic dentist and have either cavitation surgery done or
Yes,
yeah.
you're gonna meet Silvano Sen tomorrow, the dentist that I work
Wonderful,
with.
wonderful.
He's not gonna do it, but he's gonna tell you.
Tell me what needs to be
When I
done.
find it, he'll tell you. It's
Okay.
about 90 to 95% accurate.
Okay.
He doesn't know how I do it. I don't know how I do it either. I'm being honest with you. I don't want to do anything more with you. How's the headache?
Good. I really feel
Better than 50?
I feel much more functional than I did 5 minutes ago.
So it's even better than 50.
I'll let you know. But yeah, yeah.
All right.
Yeah.
Thanks. What did you all think of what you just saw? I'm curious.
Amazing. Magical.
Very remarkable.
Can you do it again?
Very remarkable.
That's why I.
And when I snap my fingers, you're gonna wake up.
Incidentally, I'm very careful when I do. This is exactly how I treat a patient.
Right.
I made no suggestion to
Right,
you. I
right.
don't want you to even have a clue why I'm doing what I'm doing. I only to the extent that I have to give you necessary informed consent for an injection. Okay? Thank you very much.
Thank
This
you.
is exciting.
Do it again.
Sam, it's now been a couple hours since I did your tooth.
Right.
What can you tell me about how you've done with as far as your headache?
Very well. I mean, usually, I would say my headache on a good day hovers around a 4 or 5 out of 10. Right now, it's probably a 1 to 2. And until you mentioned it, I wasn't even thinking about it. So, I mean, which can happen when I distract myself, but, usually I'm still feeling it in the background.
Okay.
But
And any sensation around the inner aspects of your arms?
I'm not feeling anything. No.
Not feeling anything?
No,
All right.
nothing.
All right, are you surprised?
No, not at all.
Oh,
Let's put it, I'm very happy. I was hoping this would happen while I was here. And I've
okay.
seen enough of your YouTube videos to see the things you do.
That it's real.
That it's
I
real,
don't-
so
I don't-
that's why I'm not surprised.
Yeah, I don't have actors.
Right.
They're real.
But
Hey, you guys,
maybe we
what
can
do-
revisit this
That's why
tomorrow.
you have a Zoatman machine in your at home.
That's
and
correct.
you-
any of you have any comments about what you saw with this patient? Any of you want to say anything?
Incredible. It's exciting to see.
No, I mean, I could live the rest of my life like, which I probably will with this headache, but I could live very well like this.
Okay, well, I hope you don't have to live with even a one.
Thank
on a
you.
scale of 10.
That would be a miracle.
And you can talk to Dr. Sendamar and
I
he'll give
will,
you some
I will.
insight,
I'm really,
okay?
no, I'm very excited
All
about
right,
that.
good.
Thank you very much.